if you think about the current pandemic era, all of the people, at least I saw all over the internet, people suddenly getting these hobbies. Like people started to crochet, people became sourdough people and got really into it. And that's occupational therapy. I mean, that's the heart of it.
So we're here at the Gibbs Museum at Sheppard Pratt. Founded by Dr. William Dunton. He's a really famous psychiatrist who really pushed occupational therapy. And we'd be here today if it wasn't for him. And he stated that purposeful activity can treat mental illness. So for today's video, we're here to talk about mental health treatment. We're also here to talk about occupational therapy. And then lastly, how both of those two coexist in today's society. This is Piece by Piece, episode 29. We're here in the Sheppard Pratt Gibson Museum, joined by the lovely Lisa Illum. Pleasure to meet you today, Lisa.
Yes, thank you for stopping by.
No problem. Thank you for having us. So, tell me a little about yourself and what you do.
So, I'm a woman of many hats. I am the professional education coordinator, the librarian, and also the archivist. So, the museum is part of the archives purview. For the library, I make sure that we have scholarly access to journals for medical, but also psychiatry, psychology, social work, occupational therapy, all that good stuff. Make sure that everyone has access to the most current information. And then for the professional education coordinator job, I actually, what that is we offer as a community benefit, not just to Sheppard Pratt employees, but to the world, free continuing education credits for psychologists, doctors, social workers, counselors, nurses, and other mental health folks. And so they can help to maintain their licensure and all that and make sure that they're up to date on all the current treatments for all the various disorders. So, I mean, part of it is I do campus tours. And so that's been something fun, especially post-pandemic. I've been able to bring back some of the tours. I do tours for all over the place. I have a regular tour that happens with Towson University. I also have done Loyola, some of the local high schools and stuff. And so it's a great opportunity to show people what the day-to-day of the hospital looks like. Because I think there's a lot of stigma going around about, oh, it's a mental hospital. Like, oh, everyone's going to be straight jackets and all kinds of weirdness and whatnot. But, it's a great way to show that. But it's also a great way to, one, represent the history, the super rich history that the Sheppard Pratt has. Because, we've been around since 1891. So we've seen a lot.
Yeah, it's a while.
We've seen a lot. And so really that helps just, I think any exposure and education that we can provide to the public as far as trying to lower the stigmas of mental health, I think is anything I can do to make that better is always a win in my eyes.
So in terms of stigmas in mental health and mental hospitals, what is Sheppard Pratt doing differently versus, what I guess people's typical expectations are for mental health hospitals?
So at the founding, Sheppard Pratt, at its founding, I know you have questions about this later, but basically at the founding, we wanted to be private. Public mental health care back in the day was pretty horrific. And some of it wasn't the fault of the hospitals themselves. It was the fact that there wasn't enough beds, there wasn't enough supplies, there wasn't enough care, there wasn't enough anything. And so the state hospitals were way more likely to get overcrowded. And so that's where you get the term Bedlam from.
The term?
Bedlam.
Bedlam?
Bedlam. So that's historically from Bellevue, which is still operation, but a lot better now. But basically what would happen is just all kinds of chaos within the mental hospitals. And so then that's what you get, like when you watch movies, you never see anything that's good about being in a mental hospital. And, so everything's always over dramatized. It would never happen in real life. We have way too many rules that we have to comply with in order and none of that would happen. But it did happen back in the day, and that's the thing. So I think part of what we're trying to do, not just with the stigma, but we want to make sure that the folks are supported who need the most support. And so we not only have the location that we're filming at now, we have a brand new state-of-the-art hospital down in Elk Ridge, which is right off of 80. And that is state-of-the-art. And if Moses Sheppard were around today, he would be so thrilled with this hospital. It offers a psychiatric emergency hospital, which we need more of, honestly. There's so many people who go in crisis, and so having the ability to care for those who are in a psychiatric emergency, I think is super crucial. And just being able to take some of the strain off of the other hospitals so they can care for the medically sick, not just the psychiatrically sick.
So you mentioned Moses Sheppard, who is like the founder of Sheppard Pratt. Dorothea Dix, she was a world-renowned mental health advocate.
Yes.
How did she influence, if she influenced, Sheppard Pratt in any way?
I don't think we'd be here without her. So back in the 1850s, Moses Sheppard was the superintendent of the Baltimore City Jail.
Okay.
And so while he was there, he saw a lot of people that didn't really belong there. There was a lot of mental illness. You could be in jail because you were poor. If you're a woman, you could be there if you were pregnant and unmarried. There was a lot of different things that, and the treatment wasn't that great because it was crowded and all that. And the governments have never wanted to pay a lot for mental health care. That's just been a historical thing.
The irony.
Yeah, I know. And so while he was there was when Dorothea was doing her tour. She toured across the U.S. and even spoke in front of Congress to advocate for for a ethical treatment of the mentally ill. And so she and Moses Sheppard met, and he was really impressed with everything that she talked about, and he decided to build a private psychiatric hospital. And so I don't think we would have existed had they not met. He was a huge philanthropist. He's Quaker, and he was big into the abolitionist movement. He was a member also he was a big proponent for the Indian movement also, to help them. And so this just was right in his wheelhouse of the ethical treatment of the mentally ill. So here we are.
Talk about a great collaboration. How does the greater Baltimore community, feel about the project of building Sheppard Pratt? And where was that support, so to speak? Was it more like, yes, we're here for it? Or was it a little more sideish, like, we'll watch it, but we won't really encourage? Like, where was that coming from?
So in the early times, so in the 1850s when we broke ground and everything, the Sheppard Pratt campus was super far away from the county, like super far away from the city proper. And so this was actually farmland. We purchased 300 acres of farmland and converted it over to the campus we have today. And so I think it was an easier sell back then to have mental hospitals than it is today. I think nowadays you run into more of the not in my backyard mindset, it's not necessarily from the government, but from just the neighborhoods. They have the stigma of, I don't want a mental hospital in my backyard kind of thing. And so it's silly, but I mean, it's part of the growth process. And so we aren't just our two hospitals. We have over 300 locations throughout the entire state of Maryland. And we're also working on expanding out of the state. And so we have little, community areas. And so that always you always got to have public hearings when you want to build something new and that kind of thing. And so that's where you hear the majority of the backlash. But the service is invaluable. And I think everyone realizes that, but they still don't want it in their backyard.
It's funny because given the way the world is now, I think, if anything, more people would like to have it in their backyard.
Yeah, and that's part of why we are so expanded. I mean, we're the largest provider of mental health services and special education services in the U.S. And part of that's because we've gone where the need is. And so we have that. We've been able to really, not anywhere and anywhere where we see a need, we try to have some kind of a presence. So that way folks can feel supported. And you can also take away some of that stigma of going to a mental hospital.
Right, it's not bad.
It's not bad, but if you can go to a community center instead, maybe somebody will be more comfortable with that to seek out their help in the first place. And so I think it's been really exciting seeing all the expansion happen, and we're really excited for the future to see what happens.
But you're not alone. I'm excited for the future to see what happens. So then now I want to ask, let's say for the generations nowadays who are struggling with mental issues, what's the best way, the easiest way, most comfortably to get in touch with Sheppard Pratt for a consultation or an appointment?
Absolutely. So our main number on our website is 938-3000. Within there's a referral service. We have patient advocates and referral services. You can call and get referred to where you need to go, because we do have a lot of services, but if we don't offer it, we can refer you to someone who does. And so that's one of the great things, that we can really collaborate with the other institutions not just in the area, but all around, and really make sure that you go to where that's going to be the best fit for you.
Right. And giving that best fit and that comfort coming the occupational therapist,
yes.
which I want to get into next. For those who don't know, occupational therapy is like a specialized version of therapy. This is where I might get a little lost, but please help me here, where they'll provide treatment in all shapes and forms. From my background, I've worked with a lot of physical therapists. We specialize in OT, specifically like hands, maybe feet, different extremities. But for a mental health perspective, could you tell me more about occupational therapy?
Sure. So occupational therapy has been around for a while. And so how it works with mental health is basically keeping your brain busy.
Right. Okay.
And so it's not occupation isn't a job, it's occupation isn't having something to do. And so when we formally formed occupational therapy here at the hospital, it was geared more towards things like knitting, quilting, crocheting, basket weaving, ceramics, woodworking, bookbinding, all that kind of stuff, like with your hands, where it's something that can help take the mind off of what ails you, so to speak. So technically, Sheppard Pratt is the home of occupational therapy.
Right.
And so we had William Rush Dunton join us in the very early years, and he immediately founded the OT program. Now, a little bit about Dr. Dunton. He was an avid quilter, which I think is hilarious, but in a good way. I think it's really unexpected, because he really thought that quilting especially was really good for helping the nerves, and just the way that you use your hands and you think and everything while you're doing it. You can focus on the pattern instead of focusing on how you're feeling. And so that was something, but he was also a big thespian. He enjoyed the theater. And so while he was here, we had a lot of plays put on. They even did a circus where the OT program would put together these paper mache animals. We have, like a giraffe and hippopotamus and stuff, and they would have a circus show to put on as part of just the enjoyment of the patients. And so, it's, I think, really, and if you think about the current pandemic era, all of the people, at least I saw all over the internet, people suddenly getting these hobbies. Like, people started to crochet, people became sourdough people and got really into it. And that's occupational therapy. I mean, that's the heart of it. And so I think it was a way for all of us to cope with the tremendous change and the stress and everything that we were all being put under for those years. And so we all use it, whether or not we're aware of it.
That makes me feel so much better, because yes, during the pandemic, that was a time where everyone was kind of losing their regular hobbies and outdoor activities or socializing. So we all had to kind of go into our little individual bubbles and figure things out. For me, I picked up an instrument, something I never thought I could do, but playing the guitar, just focusing on different chords. Hardest thing I've ever done in my life. It's coming along. And so following up, you mentioned the father of OT, Dr. William Dunton. Could you tell me a little bit more about his like personal life, if you know?
Sure. So he is actually related to Dr. Benjamin Rush, who is the founder of modern medicine. And so kind of a big deal. But
He's like a big, like top 5 biggest
kind of an important guy. We wouldn't be here without him. So, but Dr. Dunton was, like I said, he joined us when we were open just a couple years. And then he was with us for a while, but then went to Hopkins and I think went to Spring Grove afterwards as a medical director. Okay. His family was raised here. So we have, back in the day, everyone lived on campus, our staff and everybody, doctors, nurses, everybody lived on campus. And so sometimes, so his family, his boys would help him set up the circus and build the sets and stuff for some of the plays and stuff. So they had a very active role kind of in helping the patients.
Wow. So it's almost like it was meant to be, like they were kind of cultured into it.
Yeah.
Wow. It's really cool. All right, let me give the next questions we got here, because you kind of told us what OT is, and that was my next following up question. So, what about Sheppard Pratt history and mission made it a suitable environment for Dr. Dunton to develop occupational therapy?
So Sheppard really strived to be different from other hospitals in that we wanted to approach the patient holistically. And in the early days, there wasn't a whole lot of treatment actually available for mental illness. It was more convalescent care and comfort care. And so it made sense that when Dr. Dunton came in with this very strongly, his strong opinion with occupational therapy and having patients be busy and not just sitting and languishing, it just fit right in. And so actually, I don't even think it was a hard sell at all. Our first CEO or president and medical director, whatever you want to call him, the big cheese, was already on, like, they were on the same wavelength. So it was just really, really easy. And we're still doing occupational therapy today. It's just not necessarily with woodworking and gardening and stuff. We're doing music therapy and dance therapy and yoga and art. And depending on what day and time, if you were here, sometimes you'd be able to hear some of, like, they bring in drums and they'll like use drums as part of a music therapy for some of our patients. And so you can sometimes hear that through the ceiling because there's patient wards directly above where we are.
You're on top of it. I'm sorry. You're literally answering like my next question to my question, because I was going to ask next, what place is there for occupational therapy within today's society?
Everywhere.
Exactly.
Everywhere. I cannot stress this enough. Especially, it's so easy to sit on your phone and doom scroll all day long, and people get really addicted to it. There's that instant serotonin release that you get. You just, all of that constant stimulation is constantly stimulating for the brain. And I think a lot of us have a hard time putting that phone down.
Yes.
And garbage in, garbage out is my opinion. And so if all you're looking at is negative stuff, or if you take the time to unfortunately read through any comments to people's posts, there's always horrible things being said. It just, everything about that phone brings about just, it can affect your mindset. It can affect your well-being. It can affect how you feel about yourself in general. We have a child and adolescent mental health crisis right now. And I can guarantee you part of it's because of those phones. And so I think this is something I'm personally working on too. I'm addicted to that phone. And so I think it's really important to find a different occupation to do my time, to spend my downtime instead of looking at the horrible, whatever horrible news is of the day, or anything like that. I think it's really important for folks to not read that and not have this screen and not do that. And so if you can find puzzles or any kind of anything that's not just sitting.
Like stimulating, but you're not the one stimulating.
Right.
Yes.
Right. And so I think it's super important for everybody to do something to get away from this thing. I think we have more and more studies just showing how detrimental it is, not only to our mental health as grown-ups, but I mean, to the kids, it's catastrophic.
It's really bad.
And it's also hard to cut that. I mean, we're all kind of stuck with the hunch neck and everything, looking at our phone.
It's bad.
So I think, that's something I think everybody should strive for, is to have some kind of an occupation, whether it's you want to do sourdough or crocheting or knitting or whatever, diamond painting paint with the little rhinestones or whatever it is going to be a million times better than just sitting on your phone all day.
That I agree with. For me personally, I used to have a really bad phone addiction. So what I did was I took all the color off my phone. So people look at me different, like, why is your phone in black and white? Or like, oh, this is weird. Or like, but it's the way I become stimulated or reset myself is I force myself to be bored. Mm-hmm. So I learned from my social psych professor at UMBC. She said that the engineers at like big phone companies, they purposely make the colors brighter than your environment, which will help stimulate you more, making you want to be on your phone longer. And once she said that, everything kind of clicked for me, because there's moments I find myself like really like doom scrolling or caught in my phone. And so I'm like, all right, how can I make the phone boring?
Yeah.
And so I looked on YouTube, and like some guy, I forgot his name, his name's Demo. He explained how taking the color off your phone for like a week, see how you feel afterwards. Did that, and it was like, I don't want to be on my phone as much.
That's amazing. Yeah, I think everything about the phone and social media and just the phone in general is bright and exciting, and you can have all these ringtones, and you can watch YouTube videos and blah, 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 blah. But by the end of the day, you're overstimulated. Mm-hmm. You're probably not feeling very good about yourself.
Correct.
And you wasted 8 hours.
Entirely. This is where I'm not a professional or anything, but I realize when you're in a learning state, you're trying to segue, you put yourself in little blocks, correct? So for instance, let's say like you have to go to work and you wake up in the morning. If you're on your phone first thing in the morning, you're kind of giving yourself busy thoughts or busy work, or just like overstimulating yourself for no reason. And then you get in the car, you listen to music, you're stimulating yourself. And then you try to go to work, and it's like, that's the time you have to be quiet and kind of get the work done. It's hard to segue from those paths when you're overstimulating yourself constantly. So you need like a little period of boredom or quiet in between in order to kind of move on.
And it is, I think, too, we haven't been taught officially, but I think we've been taught that it's okay to be busy, that you should be busy, that it's cool to be busy or overly busy. And so that hustle culture, I think, is helping kind of perpetuate that overstimulation. And then you add the phones in and everything else, and then everybody is just overstimulated and can't focus on anything.
Yeah, you make conversation. Yes, literally. I'm so worried for the future sometimes.
Well, they're learning. I think we are learning. And that's the thing that is, as bad and negative as we all say social media is, and we still use it, we are learning that it's not all likes and comments and everything. So we're learning more the actual effects of what's happening. And I think we're going to really come up with, I think there's going to be a shift, hopefully. I hope there's going to be a shift in kind of what happens with the kids and everything, because it is doing them a lot of harm.
I agree.
But it's doing adults a lot of harm too, but we're noticing it especially on the kids right now.
So here's my next question is, do you see similarities between occupational therapy and your work as an educator?
Absolutely.
Both work to expand people's minds and help them find joy and self-improvement. What would you say is your biggest takeaway for that, for like you personally?
For me, it's about the giving. So I like to be able to provide things. So like whether it's knowledge or a listening ear or shoulder to cry on or whatever it is, I feel very fulfilled being able to provide tours to like all aspects of my job. Help me feel incredibly fulfilled. And I know a lot of people can't say that. I know I'm incredibly blessed to be in the position I'm in, because it's not always the case. I happen to fall into something that worked out really well for me and suits me personally. And so I have a lot of empathy and sympathy. And so like you can run into patients throughout the day here on campus, and some of them are just finding out that they've been diagnosed with a disorder and they don't know how to grapple with that. And I can tell them based on my own experiences that you are not your disease. You are not your mental illness. It's a part of you, but it's not who you are. And I think sometimes that alone, they really grapple with, what do I do with this information? Like, I don't feel like I'm bipolar. Well, maybe you don't feel like it, but you are, but that's not who you are. And so, being able to help folks find the information, find the answers that they need, whether it's the patients or whether it's our own physicians and clinicians that are helping these folks, like, it's huge for me.
So a little bit of self-improvement and self-discovery.
Exactly. And knowing the resources that folks need to get the best and most trustworthy information, and to find it quickly so they don't have to take time away from taking care of their patients. I can find it for them. And so that's something I always make sure I let the doctors know when we have new ones come in, like, I will look for you. Just tell me what you need and I'll find it, so you don't have to take the time to find it yourself.
And that's what you're here for.
Yeah.
We appreciate it. Okay, so let me see. Next question. How is Sheppard Pratt continuing the legacy of Dr. Dunton today?
Well, like you said before, we still do occupational therapy. We still make sure our patients aren't kept below ground. We still have, the patients have access to light and stuff. That's actually part of Moses Sheppard's bequest, building this campus. But it all, I think, ties together in that basically we aren't like other hospitals where we just keep you in a room and leave you there. We want you to have therapy. We want you to be supported. And when you leave us from your inpatient treatment, if you go to outpatient treatment, or you can go home all the way, or whatever the case is, you're going to have support. And that's, I think, a big thing. We have a ton of social workers here that do a heck of a job really helping folks handle a whole plethora of things that I can't even wrap my head around that I But I'm in the occupational therapists, really help people to have breakthroughs through art or through whatever means of expression that they decide to do. It's just the mental health care is incredibly important, and what we do here is also incredibly important. And I think the more people that we are able to touch, the more people that we are able to provide occupational therapy to, or any of the treatments. I mean, really, if we can help them to improve in some way, that's a win. And so, and maybe they'll be less likely to avoid treatment in the future, should they need to come back.
So I kind of teach them how to handle themselves when the time happens. Something.
What to do if you are in a crisis, if you do, let's be honest, a lot of these folks are very, very sick and have mental health crises, multiple, plural. And so it's good that, if they go through a process and come to us for help, they'll kind of know what to expect for the next time when they are in a crisis, and maybe they'll be less likely to fight coming to get the help. We never want to involuntarily commit patients. It does happen from time to time, but we really want them to be invested in their own treatment. It's just easier for everybody, and they're way more willing or likely to have it stick a little bit better when they're not being forced into it.
Just like school, you're not being forced in lessons. They keep it
right.
Given. I like it.
Right. It's more of a collaborative event than just I'm going to tell you what to do and here's some pills. Bye.
Thank you. Me, formerly, I was on that road a while ago. My mom kind of put me in that era, but I'm grateful to be out of it, and I'm glad there's people like yourself who encourage the right way of handling it versus just saying, do what I say, this is good for you, here.
Yeah. I think one of the issues too, though, is just it's expensive. Mental health care is so expensive. Sheppard Pratt has been literally talking to Congress since the 1940s to provide more funding for mental health care. That was even we were a big part of mental health care being included in Social Security. and then Medicare and everything. So like we're constantly trying to help get more funding because it is so expensive. And that alone is sometimes enough to keep people from not coming.
Yeah.
And because they don't know how to do it. You know, they're like, well, I can't afford this. And there are ways we can help, and other institutions can help. Like there are plenty of programs and stuff that we can help with to get that funding, kind of get the ball rolling. But it is sometimes expensive. It's an investment in them.
But that's how it is.
Yeah.
You got to pay for the help you want. Like,
Yeah.
You can't get a Mercedes-Benz for $15. You got to kind of...
Not a good one.
Right. Not a good one.
Maybe a Matchbox car.
Well, you were mentioning help and the programs. So could you tell me about what programs specifically Sheppard Pratt has to offer?
Oh, geez. We offer so much.
Give me your top 5 or top...
So we have... we cover eating disorders. We cover autism, developmental disabilities. We cover... So like I said, we provide eating disorders, autism, developmental disorders, geriatric disorders, including Alzheimer's, other memory disorders, TBI, traumatic brain injuries. We offer veteran services. We offer kids, like basically from when you're born to when you pass away, we have a program available. And maybe not at this specific hospital, but within one of our community locations. So you name it, we got it.
I love that. You heard it here first. Let me see. Anything else you'd like to say to wrap it up? Anything you want to give the people, words of advice that people might think ungenerally for mental health? So
everyone has struggles, and that's normal. That's a part of being a human being. That's a part of going through life, and it's not bad. It's not bad if you're feeling horrible. It's not the end of the world. And there's help available, whether you reach out to a friend or a loved one or somebody that you're comfortable with, a pastor, whoever. Just reach out. Don't hermit yourself. Don't put yourself in a bubble and lock yourself away. I think the hardest part with any mental anything is that you gotta fight that wanting to isolate yourself. If you're depressed, if you can't get out of bed, just get out of bed. Just try to get out of bed. And that's the first step, and that's the thing. It's always like, if you feel like you're in danger, call 988. That's the suicide hotline. There's people who can help you. It's a free number. It's anytime, 24/7. There's all kinds of things around. You just got to know where to look. And it's not on Facebook.
Yes. So get off the phone, more importantly. Get off the phone, or get on the phone. Yeah,
use the phone to call, but don't let any feelings of embarrassment stop you. Because so many people who work in the field have experienced it themselves. And I think that's part of why we're all kind of here. It's because we understand. And we do understand. And if you go to a place that doesn't really fit your needs, go somewhere else. It's okay to go somewhere else. It's okay to get a second, third, fourth, fifth opinion.
Because you're not hurting anyone's feelings.
Exactly.
See you do better.
Yeah, exactly. So definitely don't let that stop you. There is light at the end of the tunnel.
Awesome. Well, thank you. Last thing I'm going to ask then, is there anything we can do or the viewers watching can do to support, the Gibson Museum and Sheppard Pratt itself?
Get the word out. I think the more exposure that the hospital and its mission can have, the better for everybody. The bigger we get, the more opportunities we can provide, the more help we can provide, the further our reach can go. And so, whether it's special ed or whether it's a regular mental health treatment or whatever, think of us. And as far as, if you're, we do have a philanthropy fund. If there's certain things that are really strong on your heart that you want to support, you can. If you wanted to make a donation, I'm not asking that you make donations, but if you were feeling like you wanted a specific program, you are able to tell the philanthropy department this money needs to be applied directly to this type of program, and they'll make it happen. And it's not just us that can do that. All of the mental health facilities everywhere have some kind of a fund like that. And so if there's one that really stands out to you, go to them. And, tell your friends.
You're gonna tell me sports. I tell my friends all the time, please seek mental health.
Yeah, it's not a bad thing. It's okay to have help. We're not really meant to be by ourselves on this earth. And nowadays it's way easier to be very isolated and alone and lonely. And so I think, get your friends, man. Go have cheese. Go have queso. Like tacos and queso. I'm there.
Yeah, I'm there with you. Oh man. Well, thank you so much. This was a great pleasure to have. I had a lot of fun talking to you as well. Definitely learned more than I thought I'd learn today. But yeah, so closing up, this is Piece by Piece, episode 29. Please like and subscribe. Give us a follow on Spotify, Apple Podcasts. Check out our website, piecebypiece.com. And more importantly, stay off your phone, but also use it. Use it when you need to use it. All right, thank you guys.